Whether or not you want to get the COVID-19 vaccine, that is a personal choice. That's a personal choice that's based on gathered information about the efficacy and the safety of the vaccine. Now, unfortunately, some people just don't have access to that information and then choose not to protect themselves.
Eboni Johnson of Crisfield has made it her mission to make that information accessible. And because of her efforts, dozens of people in the community are choosing to protect themselves and their families.
Healthy families is important because when you have your first baby, it's a lot of questions. You're not sure what to do.
As a Healthy Families home visitor, Eboni Johnson helps new moms with one of the toughest jobs they'll ever have: raising a healthy, thriving child.
We bring a support to the family.
That support comes in the way of supplying child development information or answering any questions.
As far as, what's been recalled, or what's the new feeding practices? How do babies sleep now? Do we put them on their stomach? Can we, do we turn them over on their back?
That includes information about vaccinations.
So we do help parents keep track of when the babies need to be immunized. And we try to also work with the pediatrician, bring information on what to expect when your baby gets their first vaccinations.
Now, Healthy Families and Community Behavioral Health have teamed up to make sure families are protected against coronavirus with the COVID-19 vaccine.
Because I'm already going into home, discussing health information, and so the families can trust that I am going to bring, accurate information to them.
It's a partnership with a very personal motivation.
In 2019, our Chief Administrative Officer, Dr. Niru passed away from COVID. And so coming together, CBH and University of Maryland came up with this project called Project Niru. And this is to acknowledge all of the wonderful things that Dr. Johnny has done in the community. And so when people go out and they need information about the vaccine, or they may not have transportation to get the vaccine, we can help.
And it's working. Thanks to Eboni's efforts, more than 100 patients have been vaccinated. For that, she's being recognized.
And from what I understand, everyone here is so pleased with what you've done. And I'm so proud of you that they have actually have a reward for you. Can I read it to you? Sure. It says, 2021 Challenge for Change Award presented to Eboni Johnson in recognition of outstanding performance and dedication to the creation of a safe and healthy community through extensive community outreach. Your work has honored the memory of Dr. Niru, for whom we have dedicated Project Niru to vaccinate rural and underserved areas of Maryland.
Thank you. That means so much, because sometimes when you're out in the community doing work, you don't realize if you're really making an impactful, doing any change in the community. So it means a lot to be able to do this work in honor of him. Yeah.
Well,
that's
you're
amazing.
doing a wonderful
Thank
job.
you.
Congratulations.
Thank you.
And back in August, Community Behavioral Health created a multilingual video to reach out to as many people as possible to get vaccinated. And you heard Eboni say that the effort was prompted by the death of Community Behavioral Health's Chief Administrator, Dr. Niru back in January.
Now, Dr. Suni Johnny is a child, adolescent, and adult psychiatrist with Community Behavioral Health. She is also the daughter of Dr. Niru Johnny. She's joining us this afternoon via Zoom. Thank you so much for joining us today.
Thank you for having me.
And our condolences about your father.
Thank you so much.
Tell us a little bit about him. What drove him to do what he did?
My entire life, he has been one of the most passionate, driven, also very laid back, and funny individuals I've ever known. I was really meant to be a doctor his entire life. My dad was a neurologist and a psychiatrist who's lived all over the world, worked with people of many different walks, and ultimately his life was about using reason, fact, science, and logic with compassion, empathy, and understanding of the people he saw to make their lives better. And we always knew that's really what fulfilled him.
Yeah, and obviously he was unable to get the vaccine because it wasn't available yet. Yeah. So tell us about the project that you guys put together in his honor.
Yeah, so this is called Project Niru. We all sort of agreed that was the appropriate name for it because ultimately, I think grief comes in many forms, and I think our approach to it was to make a celebration and meaning of his life, really to be a tribute to the things he stands for. And ultimately, it stands for the things that he would have done had he been able to get the vaccine in time. And I know our entire family feels the same way, and I know he's a part of that. We don't want anyone to go through a loss like this of such a tremendous person. And if we can take what we went through and bring it to others to get people to be vaccinated before they go through a tragedy, we want to help as many people as we can in his name.
So Eboni just explained the intention of the project to get the word out, to get more of the community vaccinated. What would your dad think of that?
He would love it. He would be so overjoyed that there's an initiative beyond our offices that's trying to make life better for so many people.
Yeah. Well, thank you for all that you are doing and community behavioral health for the community. And again, our condolences to you and your family. And we'll have information on our website about the project. Dr. Suni Jani with Community Behavioral Health. Thank you.